Good afternoon, everyone, and welcome to the Mirowitz Center today. And welcome about telemedicine, one of COVID's silver linings with Dr. Jennifer Schmidt. Dr. Jennifer is a general internist and a medical educator with expertise in quality improvement, patient safety, clinical operations, and patient access. Dr. Schmidt also has clinical expertise in the management of chronic health conditions and preventative care. She sees patients at the Washington University Complete Care Clinic, where she also serves as medical director. She is a program director of the Washington University Internal Medicine Residency's Programs Primary Care track and oversees the 15 resident programs' educational and client content. Please welcome Dr. Schmidt.
Hi, everyone. Thank you so much for inviting me to be with you this afternoon. In talking a little bit before this, I found out that you've had Groucho Marx's assistant come and someone take you to the Egyptian wing of the vet. So I'm not sure that I can compete with that, although telehealth is pretty riveting. So thank you for letting me come and be part of this series, which sounds pretty amazing. What I'm going to talk about today is telemedicine. And to me, it really is one of the silver linings of COVID. There aren't a lot, but this is really a big one. And I'm going to talk a little bit about why I think that is so. But before we get started, I wanted to tell you a little bit about me. I'm a St. Louis native. In my previous life, before I was a physician, I was a biomechanical engineer. I went to Marquette University and worked at GE Healthcare. I am a process improvement enthusiast. So the continuous improvement cycle that you can see here is really near and dear to my heart and is really what my main interests are. It's really improving clinical care delivery, how we deliver patients care. So I get to work with people who sit right in front of me, and then I get to make a bigger impact on the larger healthcare system scale. As you heard, I'm the primary care director for our training program for a group of residents who are all going into primary care here at WashU. And then I also am the medical director for the general medicine faculty clinic. I just ran my first half marathon. I did not train for it, would highly not recommend doing that. But I did recover after about 4 days. And then I am the mother of two very awesome kids, Gertrude and Wilhelmina. So what we're going to talk about today is what is telehealth and why did it take a global pandemic for its widespread use and adoption? We're also going to walk through a telehealth visit. So how does a telehealth visit work? When should you have one? How do you prepare for it? How do you actually move through the visit? And then we're going to talk about some very specific examples of how to take certain vital signs, because that can be really helpful when you're having those visits. There's also going to be ample time for questions and answers. So happy to answer anything that I can for you. So in the broadest terms, what telehealth is that it utilizes some type of technology to connect the patients to their doctor or their care team. And so this can come in a lot of different ways. It can be via video, it can be phone, it can be written communications, it can be programs that are electronic but are standalone, so where you can go onto the internet and click that you want to have a visit with someone and connect through there. Something that I would guess some of you or many of you are familiar with is my chart messaging. So this is the patient portal in Epic, which all health systems in St. Louis have. All the major health systems have, except for St. Luke's. So this is something that many of us have used pre-COVID. And another example are telemedicine visits. So that's what really took off with COVID. And that's where you can either connect with your doctor or care team through a video or phone. There's remote monitoring. So this means that using some kind of device, whether it's a blood pressure cuff or a pulse oximeter, sometimes it's something as simple as a scale where you can take measurements at home, and either then those measurements are transmitted through your device to your doctor, or sometimes you take them at home and then you use the patient portal, so a second type of technology to communicate with your doctor. And that's something that's really exploded with COVID. An example of that is it used to be that when you would go to the emergency room and you would need new oxygen because you weren't breathing well, we would absolutely keep you in the hospital. But one of the big things that grew, and one of them here at WashU especially, was for COVID monitoring. And so patients were able to use their MyChart app and to use pulse oximeters, which I think a lot of people have gotten really familiar with since COVID started, but it goes right on your finger and it measures your oxygen level. And they're able to go home and not have to stay in the hospital. They're able to be in their own bed with their family, eat their own food, which is often one of the most important things about skipping the hospital. But that was really something that never happened pre-COVID. And then finally, an example of telehealth would be remote ICUs. So this is something that means that patients can get ICU level care, even in areas where there aren't ICU doctors, because they can use videos and computers to work with the people who are there to help give that care. So it's a really great way to expand care to different people. So why did COVID suddenly make telehealth a viable option for us? So it really made the healthcare system change very quickly. And I'm sure it's not a shock to many of you that the healthcare system usually moves at quite a slow pace. Telehealth allowed us during COVID to limit your COVID exposure, but still make sure that your chronic health problems were getting treated. So just because COVID was here didn't mean that diabetes disappeared, didn't mean that your high blood pressure disappeared or your chronic pain. We still had to be able to connect you with your care team. And we could do that through telehealth while also keeping you safe. It was also really important for when COVID came that we could evaluate patients who might have COVID or symptoms that could be COVID while keeping the healthcare personnel and the other patients who had to come into the clinic safe. So it really allowed us to keep treating patients while keeping everyone safe. And this was really important because, as many of you know, the hospitals, oh, I am so sorry. I thought you could see my PowerPoint. I've been sharing with myself, so I'm going to go ahead and share that. So the hospitals were full and were filling up, and a lot of those patients were COVID patients, but we still had people who were having heart attacks and who were getting car accidents. So we want to make sure that we're getting people their care so that their problems don't become so bad that they need to go into the hospital. It also meant that patients could talk to their doctor instead of having to go to the emergency room or an urgent care. And so it really limited the emergency room use to true emergencies. So you can see here, this is from the BJC Healthcare website, that you can go right in here and schedule a telehealth visit. So you don't, a lot of us think of, well, does my doctor offer telehealth? So a lot of doctors do. It's gone up significantly. Over 200% more telehealth visits are happening now than before COVID. But even for places where you may not be a patient, you're able to schedule a visit. So this is an example of that. I'm sure if you went onto Google and you just typed in have a telehealth visit, you'd be able to find somewhere to do that. So why did it take a pandemic? Insurance companies have been very slow to pay for telehealth. I don't know why that is, but they just haven't wanted to pay for it. And so from a kind of a business standpoint, a lot of places aren't going to invest money and make things happen if they can't financially make that a viable option. So with COVID, that changed. So that was one of the reasons COVID was able to start, or telehealth was able to start happening. There were also really strict requirements around when telehealth was something that was okay to use. So it might be that a patient has to live in a rural area, or they have to be a certain number of miles away from their doctor or healthcare provider. The technology was slow. So we have to have people who have internet connections, who have smartphones, who have iPads, who have laptops, had to have the technology in place. And then there was a concern for patient safety. And that was really around making sure that your healthcare information was safe. So that there had to be systems in place and ways to connect with each other so that we were sure that nobody was able to hack in and listen to your healthcare visits and details about your health. So that took some time, a lot of that having to be built into the health record. So with this new technology, is telehealth better or is in-person care better? That's a very hard question to answer. And so there's a lot of studies, and there have been a lot of studies on this exact question, which one is better? And there isn't really an answer for that because one isn't better from the other. It's just when is one better in a situation than the other. So number one, having telehealth increases your ability to connect with your doctor and your healthcare team. So as I said before, there may be rural areas that don't have access to certain specialties or certain levels of doctors. So this allows those areas to immediately be in contact with a physician or healthcare team. It also is for people who have limited mobility or transportation. Personally, I have found it to be really great for some of my patients who don't drive and who have to coordinate their visits so that a family member can always bring them. And it's been a really good way for us to be able to connect more frequently without them having to continuously get a ride. So that's been a great opportunity. It can lead to faster diagnosis and treatment. So one example that is really important to get treated fast is shingles. So when somebody has a rash and they think it's shingles and they need to get in to see their doctor so the doctor can examine it. Is it shingles? Yes or no? Do you need to be on medicine? You should start that medicine within 2 days. The ability for you to hop on a video visit, show somebody that rash, and then you can get that prescription right away means that you don't have to coordinate driving there, getting into the office. So it can really expedite things and move them along. And then in general, better follow-up care. So one thing that I use this for is for patients who I might start on blood pressure medicine. Instead of having them come back into the clinic 3 months later, it's really easy to touch base with them. Maybe a month later, they check their blood pressures at home. They send them to me. These look great. All right. Don't even need you to come back. Or maybe these are a little bit high. Let's adjust your medication right now between visits so that when you do come back, you've now had better blood pressure control. It's also less expensive. So you don't have to be in a clinical space. You don't have to spend the money on gas and driving there. It can really be a super cost-effective strategy. I also want to say that I'm a big believer in the patient portal. I really like it a lot to communicate with my patients. There are some things that you really need a visit for. So for example, sometimes I get a message that has, about 3 paragraphs single-spaced about a concern that somebody has and these new symptoms and what should they do. Often that really should be a visit. However, if somebody has a super quick question, or like I said before with that blood pressure example, here's a list of my blood pressures. Does the medicine need to be adjusted? Yes or no? Well, that saves you a copay because we can do a super quick exchange. So when you should use it, one, when you can't have an in-person visit. So for example, when patients have upper respiratory symptoms and we were concerned that they had COVID, we didn't want them to come into clinic because they could infect other people, but we also wanted to make sure that they were getting the care they needed. So telehealth was a great opportunity for that. Also, sometimes you can do it when it's more convenient. So sometimes we don't need to examine you. It's really more about the conversation. Sometimes we don't need you to have to drive all the way into clinic. And so that can also be an opportunity. Really, the answer is in-person and telehealth, one is not better than the other, and they're really best used when they're used together and not instead of each other. So telehealth can be a really great complement to those visits that you have normally with your doctor. I would say that a good rule of thumb is that everybody should have at least one in-person visit a year, just to make sure that your doctor is able to examine you, because a physical exam is really important. And then based on other things that are going on with you or your other health conditions, that's a great opportunity to talk with your doctor about how many of your visits should be in person and how many could be via telehealth. So thinking about preparing for your visit, have all your health information with you. It's really great if you can bring your medicine bottles to have them with you right there for reference and review when you're talking with your doc. And then collecting any information that you may have at home. So if you track your blood sugars because you have diabetes or you track your blood pressures, that's a great thing to have that paper or that tracking document with you right there. It's great if you can check your vital signs. So just like when you come to clinic, we always check your blood pressure and your heart rate and your temperature. That's something that you can do at home. And we're going to talk through the steps on how to do that to make sure you're getting accurate readings. You also want to make sure that you have the right space for your visit. So one of the rules of telehealth is it's important where you are located, because wherever you are located, that's where they consider the the insurance considers us to be practicing medicine. So for example, if you come into my clinic, I practice in Missouri. I have a license to practice medicine in Missouri. I also have a license to practice medicine in Illinois. So I can see you if you're physically located in Missouri or physically located in Illinois. However, if you're on vacation in Florida and something happens, it might seem like a great opportunity to have a telehealth visit. You can connect via Zoom, and you can talk with your own doctor even though you're not there. But unless your doctor is licensed to practice in Florida, they can't have that visit with you there. And that's kind of a confusing thing. So that's really important to make sure that you are either in Missouri or Illinois, depending on where your doctor has that license. And that should be part of the check-in information that you get from your clinic. You also want your space to be quiet and private. Absolutely able to have other family members there, just like you can bring them to clinic. I encourage pets presence. So it's been a really fun thing, I think, with COVID to see, you get to meet people's dogs and cats. A colleague of mine had her patient show her around. She paints at home, so she wanted to show her some of her portraits. So while I wouldn't take a lot of time doing that, it is kind of a nice glimpse into really who you are and where you live. You want to make sure your phone or your tablet or your computer, whatever you're using, is charged or that it's plugged in. And then if you haven't used Zoom or whatever the software is that your clinic uses or this telehealth uses, you want to make sure that you tested that out so that you don't do half of your talk without sharing your screen, like some of us might have done today. And then just like in the clinic, your doctor might be running late. So depending on how things are set up, these telehealth visits might be right in between in-person clinic visits. So I would say if your doctor's more than 15 minutes late, give the clinic a call. If you're having any problems connecting, give the clinic a call, because you want to make sure that you don't miss that visit because you think that there's an error, you don't see your doctor there. But I know we all appreciate that little bit of time grace. So what should you do during your visit? So the start of your visit might be different depending on what your doctor's office does. So some doctor's offices, I know at mine, I log right in and I'm the first and only person that you'll see during your visit. There are some other clinics where someone from the doctor's office staff might call. So it might be an MA, a medical assistant, or a nurse who calls you, talks to you about your medications, talks to you about your vital signs, puts that into the computer, and then either you then directly connect with the doctor or the doctor gets on several minutes later. And you want to treat this just like an in-clinic visit. So talk with your doctor just like you were in clinic. Anything that you would normally share with them, absolutely feel free to share. And you want to make sure you can give the visit your full attention. So I've had a couple instances where someone has taken their visit while they're driving in the car. And I know I can't, if I'm driving, also have a visit with my doctor on a video. So I would skip having visits in the car or in public places because we want to make sure all your health information is safe and it's private. And usually if you're in Schnucks shopping, that's difficult to do. I'll also say that during the visit, I know that for physical exam things, sometimes you can do certain maneuvers or see certain things on the screen. And so, I would say make sure that you're in a space where you can move around a little bit just in case that needs to happen. You want to make sure that after your visit, you have access to an after visit summary, just like you would have when you go to the doctor. Usually you get that packet of papers and it says, here is your next visit, here are your medication changes. Ask how you would get that. It might just show up in your portal. Maybe it's something they need to email you to. Most offices would also be willing to print it out and send it to you via mail if needed. So really quickly, we're just going to go over how to take your blood pressure and check your heart rate or your pulse at home. I think most of us have down how to take our temperature. So these are 2 examples of blood pressure cuffs that you can have at home. You can also have a manual cuff, which includes that little ball that you would pump up. But you can either get a cuff that goes on your wrist or a cuff that goes on the upper part of your arm. So for blood pressure, it's really important that you take your blood pressure. I usually tell people to take it at a consistent time of day if they're tracking it over time. But whenever you take it, you want to avoid caffeine, exercise, other stressful things within about 30 minutes of checking your pressure. So if you go out and exercise, don't come home and check your blood pressure right away. I also recommend using a timer. So you should really sit down in a chair and rest quietly for about 5 minutes before you take your blood pressure. I use a timer because when I think it's been 5 minutes, it's usually been about 23 seconds. And so the timer helps me to make sure that I'm really keeping it on the right time. Something that you could consider if you know you're going to be doing some home visits or telehealth visits, or if you're going to be tracking your blood pressure at home, is to actually bring your blood pressure cuff, take it yourself when you're in clinic, and then have the clinic staff also take a blood pressure. And that'll show you how close those two blood pressure cuffs are and if they correlate. So once you sit down for your 5 minutes, your timer goes off, you put your blood pressure cuff on, and again, you'll either put it on your wrist or you'll put it up here on your arm. And you want to make sure that your arm, just like this gentleman here, is resting on a table. And that blood pressure cuff, if it's on your upper arm, is right about at the level of your heart. And you want to relax your arm as much as possible so that if someone were to push it off that table, it would just kind of fall at your side. Personally, what I've found is that this is a much harder thing to do than most of us would think. So when most of us think we're relaxed, we're really not. So really try to relax your arm as much as possible for that accurate reading. So you've got your arm resting on that table, your arm is relaxed, your feet are flat on the floor, legs are not crossed. Then you just go ahead and push your button, and that'll give you your blood pressure reading. Some of these machines will also give you a pulse reading. And if that is the case, excellent. If you take a blood pressure reading and you think, you know what, this reading is just not right, I would give yourself probably 1 or 2 minutes to wait and then to repeat that blood pressure reading. Because the way the blood pressure cuff works is it stops that blood flow and then it lets blood flow go into your arm. So you want to make sure that you have enough time to let your arm get back to its normal space before you were to recheck it. So for heart rate, I know there's a lot of words on this slide. So what I would ask you to do is to take your hand, either hand, and to go ahead and look at it. And you want to look at the side of your wrist that is on the same side as your palm and is closer to your thumb. And you're going to use the index and third finger of your other hand. And it's really important that you don't use your thumb. You want to make sure you're using these two fingers, second and third, and you would place it gently. And I think sometimes when you lay your hand down on the table, it's easier to feel. Right where you see in the picture, just below your thumb, underneath your wrist crease. And you should just apply just enough pressure, a little bit, and you'll feel a little bit of a beat there. Don't push really hard. And that is your pulse. So you can hold it there and count for a full minute. A lot of times what most of us do in clinic is that we'll do it for 15 seconds and then multiply that number by 4, or 20 seconds and multiply that number by 3 to get to that full 60 seconds mark. So the things that I would like for people to take away from this as somebody who does telehealth visits is, one, it's a really great way to connect with your doctor, whether it's video visits or phone visits. Using the patient portal to be able to share readings from home or ask questions between visits. It's a really great way for you to stay connected between the every 3 months, 6 months, or 12 months that you might see your team. It's also best when you pair it with clinic visits instead of doing it instead of clinic visits. So really they should work together for you to get the best care that you need. We love seeing your pets. Everyone likes that. It's really fun to get to see our patients in their real homes and who they really are as people. You want to make sure that you're in a quiet and private place. And then a big one for me is if your doctor is running late or you have difficulty connecting, please call, because usually we can resolve those things and we don't want you to miss an appointment or get delayed care because it's difficult to connect. The other one I would add to that is for patient messages that you send through the portal. For most of those, I know in my clinic, we ask patients to give us 24 to 48 business hours to respond. If 2 or 3 days goes by, it's never wrong to send a message that just says, hey, I sent a message a couple of days ago, just wanted to make sure it didn't slip through the cracks. I think we all understand that happens sometimes. And I know I wouldn't want to miss a message just because of a mistake. So I don't think you should ever feel like you can't do that. So that is what I have today. I'm happy to answer any questions that I can answer. We have a lake, or we have a house out at Innsbruck, and these are my two girls last year swimming on the beach while I was probably doing telehealth visits.
So if anyone has any questions, if you want to stop your share now, then we can, see everyone on the screen. And then if anyone has a question, you can raise your hand or type something in the chat. There was some great information. So, and, I personally have wondered about because, my doctor has often said, well, if you have any questions, you can either call me, but it's hard to get through these days on a call. And he says, or we can do a telehealth. And I've just kind of personally shied away from the telehealth thing because it's new. It's new and different. So anyone else have a question?
I unmuted me. Do you hear me?
Yes, Joan. Yeah, go ahead.
Can you talk a little about the co-pays? We don't have Medicare Part B. We use our Blue Cross Blue Shield. Are they going to charge me a full copay for a telehealth visit?
So I don't want you to take this to the bank, no pun intended, because this is not my personal area of expertise. And I know that billing is different depending on what clinic you have and how your insurance is billed. But typically, when you have a video visit, so like are doing right now, like via Zoom, and you can see me and I can see you, those are typically billed just like if you were in the clinic. So that would be like a regular office copay. A phone visit is billed differently, and those are usually billed based on how much time the physician is on the phone and being part of that visit. Does that answer your question?
It does. Thank you.
Sure.
And does it help if you do want more specifics that we could call our own clinic, where our clinic doctor group or even send a doctor group message through, and they can help us understand a little bit more about the specific cost?
Absolutely. I think that's a great idea. They should be able to give you much more specific information for their clinic, because nobody wants to get saddled with a surprise bill.
Okay, thank you.
So do we have any other questions today?
Well, I had an experience I'd like to just pass on and just get your opinion on. I usually get on the scale every morning because I've been told that's the best time of the day because you're at your lightest weight. And a couple times I went to the doctor, my internist went to the office, and they were going to put me on their scale. And I said, well, I know what I am. I gave them a number, which was my weight that day. They wrote it down on the system. But then my own internist, the doctor, she became very annoyed the next visit when she found out there was like a 9-pound difference between the prior visit and my number on my bathroom scale. And she said, don't do this again. But, to me, 8 or 9 pounds is significant. Even though my weight is in the normal range, I don't have a weight problem. So I just wonder if anybody else ever tried this and if it had any problems with the doctor.
My recommendation on that is that there's definitely can be a difference between scales. And it can be up to 8 or 9 pounds, just because scales are different and they're probably calibrated differently. I think the most important thing is that
excuse me, but your shoes alone could be
right. Exactly.
Wearing shoes on the scale.
So what I think is important is that you really are just make sure that your doctor knows that. So if you were to say, my weight today is from my home scale, not on the clinic scale, that's just an important thing to share with them. Same thing that a lot of times with blood pressures, my patients might say, oh, my blood pressure at home was this, and today in clinic, it's something different. So that's also something that's important to discuss. So I would say the most important thing is that if you're using a weight that's not the clinic weight, that they just know where that weight's coming from.
And one more thing, I think you mentioned this before. I have a blood pressure cuff. I put it around my upper arm, and It seems like every time, the first time I do it, I get a ridiculous high number. And I did what you said. I wait a minute or two and take it again, and I get a more reasonable number the second time. I'm not sure why it's happening, but
I would definitely bring
you know,
that pressure cuff with you to the clinic and see how it matches up with the one there. And I'd make sure that you're maybe taking a couple extra minutes when you sit down. It might be that your body just needs a little bit longer to kind of reach its steady, calm state, because everyone's a little bit different.
okay, thank you.
Sure thing.
Dr. Schmidt, do you have a preference on the cuff one or the arm one as far as the blood pressure things?
I don't, because I think a lot of that is how well you're able to get it on. And I will tell you, putting a blood pressure cuff on is just not a gift that I have. I really struggle with it. And so whatever one you are able to get consistently and put it on the same way, I would go with that. And that's, again, though, why I think that, comparing it to the clinic one, if mine at home on my wrist always runs 10, higher than the clinic, then that's a really good thing to know when you're at home taking it.
Yeah. Yeah. Well,
I think
and
that's a great question.
I guess the key is the consistency of it.
Right.
Because I know I have one at home, but it's an arm one, and it's hard to get on.
I think that it is hard to get on.
I have a challenge with that. So that's why I was wondering if you felt that the wrist one was just as accurate.
I think if the most important thing is you can get that thing on consistently. So I'm with you on the wrist stuff. I have to be honest.
Okay. Does anyone else have any more questions today or comments? Well, we want to thank you so much. This was really very helpful to understand the telehealth medicine. And one other question, would you be willing to share your PowerPoint with me as a
Absolutely.
PDF? And then
Sure.
I can forward it to the participants and the people who didn't get to come today. And then, they can also review it or view it, the recording on, the Zoom on our website. And so thank you so very much. It was very helpful.
Absolutely.
Very
It was my
helpful.
pleasure. I will go ahead and send that to you this afternoon. Thanks so much for inviting me.
Thank you. Thank you everyone for being here today. And again, we thank you very much. And
Bye-bye.
bye-bye.